Good afternoon, everybody. I found out about this, Paul, when Representative Hall called and said, have you heard about the meeting? We're going to be talking about tax cuts. I'm not sure that I'm supposed to be here, but I'm glad that I'm here because somewhere along the way I heard a statement that said, together is a beautiful word. Coming together is the beginning. Staying together is progress. But Lord have mercy, working together can be success. I stand before you as the 9th chair of an organization in its 74th year, the first female. We have 9 standing committees. And they ask, what are your interests? I think I could list every one of the ones. I can't, in fact, I only have a few minutes, and one of the jokes I tell sometimes, I have very few words. And I'm known to talk a little bit. But I'm so glad that Representative Paul Lupke is here. He's an excellent, excellent representative, and we are pleased to vote for him. A part of what we are looking at right now are budget cuts in an economy that is sick. The problem is we have allowed the cancer to metastasize. And unless we come together with all of our personal interests to deal with all of these things that I'm talking about, we start off with a committee, a health committee, a housing committee, an economic committee, a civic committee, a youth committee, a religious and human affairs committee, but I'm going to just deal with 2 of the basic ones right now, at the top of the list that many of you have spoken to. And if I was teaching a class, what are those 2 at the very top? The first one that persons have been talking about, it starts with the H, health. Everybody in here. Now, the alcohol tax and the cigarette tax, you ought to bombard that doggone legislature. How many of you have really called? How many have you, but how many have you in fact got some folk, not in your neighborhood, but those folk who are now paying $4 and some cents for a pack of cigarettes? We are not pulling enough together. People are working in isolation. And so I'm saying health. Now, one of the things that my son basically is a dentist. He actually served 15 years in an underserved area. And in Cumberland County, his clientele was 85% white. And he looks like me, so y'all know he didn't have a large clientele. But many times we think about it, he probably is one of the few dentists right now in Durham County taking up Medicaid or Medicare. He finally came home to start his practice. But the dentists are mistreated. So health care. The other one is what? That starts with the E. What is it? What is it? Education. The racial disparities right now, we are paying more to imprison folk than to educate them. It is, in fact, a sin for persons to, in fact, talking about increasing the class sizes in schools that are already in pathological conditions. So those 2, the dental health situation, and I don't want the man from the professor over at UNC Chapel Hill's public health, I knew Greenberg. And Cecil Sheps, I worked there for 15 years trying to increase health professionals that happen to be minorities to go into underserved areas. My son served 15 years in an underserved area. But what we've got to do, number one, another one that I want to give in terms of social justice, but I want equitable treatment, not equal treatment. I used to be a student-teacher supervisor, and if I went and saw a teacher, Dr. Allison, I'm treating everybody the same. I said, you're the worst person in the world. You can't treat them the same. You have to treat people equitable because they bring different conditions. So we want to, in fact, talk about equitable treatment. Senate Bill 461. How many of you have heard about that? Senate Bill 461. That is where they are trying to, in fact, establish the statistics that will give us reasons to believe those folk on death row look more like me than some of the majority of the people in this audience. There are 4 of them right now. There's a history that they have, in fact, been released based on they were able to, in fact, find out. So education, health care, social justice, prisons, spending money for prisons rather than education, jobs, The last hired and the first fired. Y'all know who they are. Cut out some of this administrative costs. Don't cut those classroom teachers 113. You can see people in the administration, and time for me to close out. Again, together, beautiful word. Coming together, the beginning. Staying together, progress. But working together, and I didn't tell you the organization that's 74 years old with no paid staff and no paid dues. That's the Durham Committee on the Affairs of Black People. I'm not sure you all have heard, but it's a privilege for me to be here tonight to share just a little bit, because we have some of the same issues. We are happy to, in fact, join in to see if we can get some things that are absolutely critically needed in healthcare, education, and jobs.
Before we get some comments and some feedback from Representative Lupke, we have one last speaker. As far as I know, I have one last comment sheet, and that would be Charmaine Fuller.
Good afternoon, everyone. I am the director of the Carolina Justice Policy Center, a member of the Durham Committee on the Affairs of Black People, the vice chair of the North Carolina Black Leadership Caucus, a member of TogetherNC North Carolina. The reason I hold so many hats is because we have so many problems. If we're going to say that children, as our governor has said, are the priority in North Carolina, then we must remember, and she must remember, that if your parent is in prison, that you are 70% more likely to end up in prison yourself. And I say this from a criminal justice organization. 70%, not 7, 7-0. 70% more likely to end up in prison yourself. We have a situation where we're cutting teachers, we're cutting teacher assistants, we're cutting the mentors in the school, we're cutting health care, we're cutting funding for people with autism, we're cutting mental health services. And at the end of the day, North Carolina says, I'm sorry, I did not have enough money, just go home. Go to the homeless shelter. I can't pay for you. I'm sorry, my hands are tied. But at the end of the day, we will spend $26,000 to $32,000 per year to incarcerate one inmate in North Carolina. We have over 40,000 inmates in prison tonight during this thunderstorm that so many of us decided to come out in. 40,000 people. We have over 100,000 people right now who are involved at some level of the criminal justice system. We have a flip-flop budget. If we make sure that programs such as sentencing services, criminal justice partnership program, TROSA, drug treatment courts, not to mention mental health programs are funded, then we save the state money. We're spending less than $7,000 per year to educate one child in North Carolina school system. But we'll spend 4 times that much to incarcerate one person. Community programs save us money. They keep people employed. When we talk about the jobs that we're getting rid of in North Carolina, no one is tallying in the number of jobs that will be lost when parents have to stay home to educate their own children. When parents have to stay at home because the nonprofits that they worked at providing valuable services are no longer in existence. But at the end of the day, judges still have a job because they didn't have to take that 0.5% cut for their 6-figure salaries. Beverly Perdue still has a job. Is she taking that 0.5% cut? All of her council of state members still have a job, even though half of them know little about the people that they directly affect. We need to keep these programs. We need sentencing services. We need all of these programs in our budget. Thank you.